Hello people. So this morning I'm going to do a very quick video on the HbA1c. So the HbA1c is this blood test that basically looks back kind of 100 or 120 days on looks at the glucose that is stuck to your red blood cells that are dying off. So your red blood cells last for about 120 days. And to those cells is stuck a piece of glucose, which indicates how much glucose you've been carrying around in your blood for the last kind of 2 to 3 months. So it gives you a good indication of if you're carrying a lot of glucose around, that's not a good thing. So you're eating too many carbs. A lot of people will think, oh, that's from sugar. It's from carbohydrates, refined carbohydrates, so white flour, potatoes, potatoes, oats, that kind of stuff. So it's how much you've been carrying around in your blood. So that my HbA1c IFCC was 36 millimoles per mole, and the range is 20 to 42. So in actual fact, it was slightly high, but this was taken at the beginning of February, and that would have included Christmas. So I would have been eating a lot of carbs at Christmas. Like, I'm not against carbs. If at Christmas time, at birthdays, whenever, even recently, you know, if I'm away somewhere, you are going to eat carbs. If you're with a group of people and you're out in a restaurant, I'm not going to be sitting there. I mean, there are very strict keto people, and obviously if you had something like epilepsy, you would have to be strict with your ketogenic diet. But which is how the ketogenic diet was invented, because it was the only thing that worked on epileptics to this day. More than, I mean, there are drugs, but it works very well to be on a very clean keto diet with no refined carbs at all. Maybe even no carbs. I'm not really 100% sure what suits everybody. And of course, it's different for everybody. But the HbA1c will give you a good indication of, are you eating too many carbs in general? So that was over Christmas. You're going to be having more carbs. I had more alcohol. All of that is carbohydrates and adds to that load. So I'll be very interested to see what it is. So 36 is still good. So in the American terms, that's 5.4% DCC / NGSP, which is the American terminology. And 5.4 would be a low cardiovascular risk. However, some of the more strict ketogenic people or people to do with cardiovascular risk would say that it's better that it's around 5. So I'm aiming to get mine down a little bit lower. And although I can be slipping off the wagon as well, but I'm aiming to get mine down a little bit lower to around 5. And then you have the odd person who's on the ketogenic diet a while, and their results would be 4.8, which most doctors would never even have seen. Doctors don't typically look at that HbA1c because I suppose they're very focused on cholesterol. That's fine. I literally, like I said in all my other videos, I got my results and I read them myself. So if you want to have a kind of a look inside of yourself and say, am I carrying around too much glucose? That is an indicator of your cardiovascular risk. Get your blood test done. Ask for everything. Just go. Ask for everything. Be confident. Say, I want everything done. They'll send it off to the lab. You'll get it back. Ask for the printout. They might email it to me. They emailed it to me. I printed it out myself. And read your results. And the HbA1c, if it's around between 20 and 42, that's fine. But that indicates maybe that you have too much glucose in your blood if it's high. And you could say, oh, I'm not going to eat refined carbs for a little while. You only need to do these things for a little while. I kind of cycle in and out of keto, and I use it to help clean out my system. Then I do a bit of intermittent fasting. I might do a little bit of a prolonged fast just to give my body a rest, a break, so that I can feel kind of healthy and stuff. But anyway, that's another one to look at, the HbA1c, and it checks your glucose over the last 2 to 3 months, what is stuck to the red blood cells that are dying off, and it gives you a good indication that you might be eating too many carbohydrates. Talk to you soon. Take care. That's a love heart, by the way.